So this topic was given in mind because, not because the nutritionist or the doctors do not know what meal replacements are, but it is more to equip you to tell suspecting patients that this is a scientific, good mode of at least beginning weight loss therapy or even in diabetes. So there is a lot of suspicion amongst the general public about meal replacements. They think that these powders are something which will cause side effects and this and that is the reason that I'm going to present to you some data, and I'm going to present to you some slides which will help you to actually educate your patients that meal replacements can be given and are a scientific way of trying to give medical nutrition therapy. And after that, I'm going to talk a little about whey protein, because there's so much talked about whey protein, the pros, the cons, etc. I have a disclosure to make. For part of this talk, I have speaker fees. And I'm going to be talking basically about both replacements and supplements. There is a subtle difference between the two. Now, the first context is using of meal replacements under supervision. By this, I mean under supervision of either the doctor, the treating doctor, or under supervision of a qualified nutritionist. So when meal replacements are used in this way, we are rest assured that it is part of a structured program and it is not seen as a medicine. So it's just a meal. So meal replacements under supervision are okay, but over-the-counter meal replacements or supplements is something that should not be encouraged. Now this may be used either as partial or a full meal replacement, and it can be used for variable periods of time. There's no such time to tell us that it has to be used only for so many days. It can be used indefinitely in small parts. So that is the other thing. And it is usually used as a part of an ongoing structured weight loss program, sometimes just to kickstart the process, because it works very well as a behavior modification tool. For example, it tells patients that they can make do with that much of a portion size. It kind of teaches portion sizes to patients, that this much is my meal and this is what it is. So portion sizes are actually behavioral therapy, because people are used to eating a whole lot, and this teaches them. What about self-medication? You have a lot of things going around. You want to lose weight, ask me how, and all those kind of things being given out, doled out literally by people who are not qualified. So that is what I call self-medication. So how about that? So what happens in this? Patients go buy these products on their own, looking at ads or someone telling them. It is usually based on anecdotal references by friends, relatives, or the manufacturers themselves. And the usual source of information, as you all know, is the internet, the media, the WhatsApp, or whatever it is. But on the other hand, I'm going to show you a small little survey of what physicians recommend to their overweight and obese patients. Now, unfortunately, I must confess here that a huge part of the medical fraternity has no clue on how to go about treating their obese patients. They only tell them you are overweight, you are obese, and you need to lose weight. And what is the advice that they... So immediately the patient asks, Doctor, मैं क्या करूँ? I'm doing everything, but I'm not losing weight. Give me some idea. So what do these people get told by physicians? The results of this survey reveal that most physicians recommend reduction of fast foods, sodas, and portion sizes, which is fine. That is correct advice. They were less likely to recommend self-weighing, food journals, and reduction in screen time. This is something that is not emphasized by doctors, which should be, because it's part of behavioral therapy. Meal replacements and weight loss medication were rarely advised. So this is never ever told by physician, and this is according to this survey which was done in 2009. And they based their advice more on clinical experience than on medical literature. That means what has worked for some patients, that is something that they will keep on telling, but they will not look at hardcore evidence before they tell their patients do this or do that. And they reported that a 21.5% weight loss would be an acceptable outcome, and that 10.6% weight loss is disappointing. This is the unrealistic thing that doctors in this survey mentioned to their patients. So you can see here that there is a real lack of knowledge on the part of physicians when they ask their obese patients to lose weight. So when do you give these meal replacements? Foods that are given or consumed during the meal moments, like breakfast time, lunch time, dinner time, snack time. And these are replaced by the intended food or formulation, the so-called meal replacement or meal supplement that we want to give. It is given at these particular times. And it is usually a balanced, healthy mix of nutrients with carbohydrates, protein, fats, minerals, vitamins, and all of that. And it is usually for weight management, and the energy content is targeted to be low in these meal replacements and meal supplements. And weight management also indirectly supports disease management, as all of you know. All of us know today that losing weight basically helps us to get rid of a lot of non-communicable diseases, including we today consider cancer as one of the non-communicable diseases, which is favorably affected by weight loss. So what are the options that we have? Usually, you have meal replacements which are in the format of very low calorie diets. So the so-called VLCDs. And there is evidence to show what these VLCDs do in terms of weight loss. So they are calorie controlled, vitamin and mineral fortified liquid meals, and they could be used as a sole nutrient source at least for some time. I'm not saying forever, but at least for some time. They are definitely medically supervised, by which I mean you do all the investigations before, after, ongoing, and check what is happening to the patient. Provides usually 800 calories or less, and for the morbidly obese especially, when rapid weight loss is required, they're really useful, but it is used even outside of this category, and it is safe when used as recommended, which means under medical supervision. So pre-packaged meals are medically supervised and they require behavior change. You have some available programs such as OptiFast, Advanced Health System, MediFast, etc., some of which is available here and some of which is not. Now, there are Indian companies that have come into the market that have been packaging foods and selling them as meal replacements to suit the taste of the Indian patient. And there are various phases of it. So what are the benefits of these meal replacements? It's an effective, structured program, and definitely behavior compliance is improved. One thing that I have found where I am using meal replacements is that it is very easy to follow. The patient does not have to cook a lot. It's not an intimidating, formidable thing to do to, cook different kinds of foods during the day, eat this at this time. This takes care of all the needs, and especially travelers, people who are, say, in the IT industry, or even doctors who are extremely busy, who don't have time to actually make what we tell them to make. Maybe, at least in the beginning, to kickstart, these liquid formulas can help, and that is how behavior is adhered to. It could increase nutrition knowledge. People could start to look at nutrition labels, learn how to read them, and the more regular meals and less of snacks, because they know they're not supposed to do that. So they won't do it. It's a well-defined alternative to calorie-dense foods. This is, to me at least, this is the most important thing, and that is that portion control skills are automatically learnt. It's very convenient and easy. We have an Indian study using an Indian meal replacement to that effect, where they took diabetic patients more than 20 years and took their anthropometric data, etc. And the primary outcomes was the change in average blood glucose and A1C, and the secondary outcome was time in range as seen by the AGP. And this was for 14 days, and for the first 6 days, patients were allowed to follow their regular diet. Then on the 7th day, the treatment was changed to the meal replacement, and then the AGP report was analyzed. And what did they find? What they used is they used a meal and they used an evening snack as part of the meal replacement strategy. And the results of this AMEND study showed that in the full cohort of about 550 patients, the average glucose came down when they went on the meal replacement and supplement, and so also the difference in A1C. And when they looked at the time in range, you can find that half of the patients, which was again significant, the glucose levels were in range at that time. This was also followed up in insulin taking patients, people who were taking insulin. Again, you can see the average glucose difference over here, and you can see the A1C difference of when they were on their regular diet and when they were on the meal replacement diet. You can see that over here, and this is the time in range. More patients were time in range even in the insulin taking patients. And you can see here the when there were more than 2 interventions, again you had similar results. So A1C, glucose, time in range, they were all better when the meal replaced. This is a small study, but it is like a proof of concept for you to tell you that if you use a meal replacement or a supplement, you can get better results. And lastly, coming to the role of protein in weight loss, everybody wants to know what protein exactly does. So if you have a higher protein diet, you get a gain in muscle mass. It spares the muscle mass loss, especially during caloric restriction, which is very important for us. And improvement in cardiometabolic risk factors are also seen with higher protein diets. These are studies with clinical outcomes now. When the protein diet was used for less than 1 year, it's a meta-analysis of 24 studies, 1,000 plus patients, and what they found was a greater weight loss, fat loss, and most importantly, a preserved lean muscle mass during energy restriction, which is something we are battling with all the time. And the fasting triglycerides were also lower when you use higher protein. What about when you use these higher proteins for more than 1 year? This is a meta-analysis of 13 studies where the protein was around 20% compared to low protein. There was greater weight loss. There was improvement in triglyceride, HDL, and diastolic blood pressure, but the adherence was less because adhering to a high protein diet is not very easy because it necessitates low carb, and that's not easy to follow. So these are some of the studies that are there. I won't go into this detail. This is another comprehensive meta-analysis telling you again the same thing. This is one more study which is the largest trial to date comparing lower with higher protein diets for weight loss maintenance. And it's a pan-European multi-center trial. And what they found was if you had used a high protein diet, there is less weight regain. And the children who followed the higher protein regimen had reductions in waist circumference, and a modest increase in dietary protein leads to long-term maintenance of weight loss. So this is what was seen in the Diogenes study. So you have different kinds of protein. The nutritionists here don't need to be told about this, but this is for the physicians that you have different kinds of protein that are there, which you can choose from. But I'm going to talk about the whey protein because that is the one that is talked about the most. Yeah, half a minute. So whey protein is the protein contained in whey, the watery portion of milk that separates from the curds. And what you can see here is that it is one of the highest quality proteins given its amino acid content and rapid digestibility. It stimulates muscle protein synthesis to a greater degree than other proteins such as casein and soy. So you also get a greater reduction in postprandial hunger, satiety. So this is something that we want for all our patients. So these are some studies. I won't go into the details, but suffice it to say that it prevents sarcopenia, which is very important for us. And this is a study that was done and published. So to conclude, whey protein supplementation seems to improve body weight, total fat mass, and CVD risk factors in overweight and obese patients. So meal replacements, supplements are very good motivators. Their nutritional adequacy makes them indispensable in LCDs and VLCDs. They must be part of an overall weight reduction strategy and not a standalone advice. Many people think, I take a meal replacement and I lose weight. That's not so. It has to be part of an entire program. And although the long-term data is less consistent, persistent effects are evident with respect to weight maintenance, which I've already shown you. And it is challenging because it's not easy to adhere to. protein extracts are an essential means to ensure adequate quantities of protein, especially in vegetarian and vegan diet. So that's the use of meal replacements and supplements, because a lot of our population is largely vegetarian. So I will end here, and if there's time at the end, we can take the question answer session. Thank you all so much.